On September 19, the Ministry of Health launched an Mpox vaccination campaign targeting high-risk groups, including health workers, cross-border business operators, and hospitality workers. This initiative is part of Rwanda's ongoing efforts to strengthen Mpox preparedness and response. According to the Rwanda Biomedical Center, Mpox re-emerged globally in 2022, and since 2023, neighboring countries have reported cases. Rwanda confirmed its first Mpox case in July, with most patients recovering and no deaths recorded. In an interview with Julien Mahoroni-Ingabira, Health Communications Division Manager at the Ministry of Health, he highlighted the significance of the vaccination campaign, which began on Thursday. He also urged the public to adhere to established health guidelines to help curb the spread of the Mpox. Take a look.
We identified 6 cases in total since July 27th. 4 of those 6 cases have been discharged from the hospitals where they were being followed up on. Now we have 2 cases under medical surveillance. They're doing okay, they're doing fine. But in total, this is the number of people we have confirmed to have Mpox in Rwanda. So we are continuing providing awareness messages, urging people to take precautions against Mpox. And one interesting juncture that has happened in the course of the last weeks was the reopening of schools. We have extended awareness messages throughout all the schools in Rwanda, be it secondary schools, primaries, and some other public spaces. Our messages are built on 2 main pillars: the symptoms, so because we want people to recognize symptoms and report them, and prevention methods, because we want people to know what to do once they observe those symptoms. So we will continue to provide those messages, to conduct awareness campaigns, including media-based, and also working with other organizations like faith-based organizations and private sector and public sector, to make sure that everyone has the awareness message reaches everyone. We have started vaccination, Mpox vaccination, early this week, and we were targeting very specified groups, high-risk groups. Those include people operating trans-border businesses, people working in health facilities, healthcare workers, and people working in accommodation and hospitality sector. The progress is really a good thing to observe, because we are conducting the vaccinations on the health centers, and today we have introduced a new way of facilitating people to access to the vaccine by using mobile clinics. So we have already very good results in this effort. But we would like to encourage people to keep taking precautions against Mpox, because vaccination so far is for a limited number of groups. It's not for a general purpose so far. We have enough vaccines now to conduct 10,000 vaccination. Should there be a need of increasing the number of people to get the vaccine, we will get more vaccines, but it should not be understood that the reason why we specified on the groups to be vaccinated is because we did not have enough vaccines. No, should there be a need of conducting more vaccinations, we will mobilize for more vaccinations and we'll conduct the campaign successfully. We would like to keep reminding to the general public that Mpox is a disease which is contracted through close contact. And one of the things that we would like to highlight on, we always highlight on, is that the disease is contracted through sexual intercourse. So yes, we have seen that people have started implementing hand washing strategies out there with public spaces, but we want everyone to keep in mind that this is a sexually transmitted disease, and condoms do not protect you because there's the sexual intercourse happens in a such defined context that bodies can still be in contact. So people need to know that condoms don't protect from catching the virus. So please avoid sexual intercourse, avoid close contact with someone exhibiting symptoms of Mpox.